Welcome to Climate Change and Health in Small Island Developing States, focus on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat and choose your desired language at the bottom of the screen. You should continue to keep this browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the speakers. This session is being recorded. Thank you.
Good afternoon, everybody. My name is Sally Edwards. I am an advisor in climate change and health at the Pan American Health Organization, and I will be your moderator for this afternoon's session on extreme heat. We have a great panel, starting off with Pablo Mendez, who's an associate professor in the Environmental Health Department at the University of Puerto Rico, and he will be talking about the compounding effects of climate change following Hurricane Maria. That will then be followed by Ernesto Rodriguez, who's a science and operations officer at NOAA and the National Weather Service, who will be talking about adaptation to heat and early warning systems and public education in Puerto Rico. And they will be followed by Lindonna Glasgow, who's deputy chair and assistant professor at the Department of Public Health and Preventative Medicine at St. George's University, Grenada, and she will be talking about a pilot project to establish a heat threshold in Grenada. I will now hand over to the presentations and I look forward to the discussion. Pablo, please.
Can you see my screen, Sally?
Yes, I can. Please go ahead.
Perfect. Thank you. Thank you so much. Well, I'm Pablo Mendez Lázaro. I'm a professor at the University of Puerto Rico, as Sally mentioned, and I'm very happy to be here participating on this conference on climate change and health in small island developing states. So I would like to say thanks to the organizing committee for the invitation and for designing this panel about heat impacts on public health in Caribbean islands. Now, heat has been a hazard that has been studied in many different places of the world, yet most of this research analyzing heat impacts on public health occurs in mid-latitudes, sorry, because of the one bandwidth, excuse me. Okay, so most of the research I was telling that analyzing heat occurs in mid-latitudes and in continental areas, and also in big cities and metropolitan zones in the northern part of the hemisphere, but also in the south part of the world. So, but little is know how heat is impacting tropical regions and small island states. So, let me go to the next slide. For US citizens living in the continental US, extreme heat is one of the major concerns when we're talking about climate change. And Yale University, the program on climate change communication, they did a survey a couple of years ago. And as you can see in the right side of the panel, extreme heat is one of the major concerns for Americans in the continental US. With climate change and increasing temperatures, extreme heat is also becoming important for islanders and decision makers in the Caribbean and most of the residents living here. Worldwide, heat is known as the silent killer, together with air pollution. And in the continental US, heat is the #1 climate hazard when we're talking about mortality, hospital admissions, and emergency room visits. In the left side of the panel, what you're seeing is a picture that from the National Climate Assessment showing how heat is the #1 hazard in terms of mortality and fatality when it's compared to other weather phenomena in the United States. Unfortunately, heat is, even when it's recognized as one of the most important climate hazards affecting public health, there was no national policy or program trying to address extreme heat as opposed to floods, hurricanes, or tornadoes, or any other climate phenomenon impacting public health. So for the first time, I think that the Biden administration is promoting the first initiative nationwide to protect communities from extreme heat. And this announcement came out on September 20, 2021. Back on some 2012 in Puerto Rico, our research team identified a couple of extreme heat episodes. We studied this with the National Weather Service in collaboration with other epidemiologists here. And we made the decision to analyze the potential impact of this episode on the Puerto Rico population. And we found that not only 2012 was one of the hottest years on record, but also since 1980s, but also that it has a lot of important impacts on public health. And it was associated with an increase in relative risk and mortality during that summer for population with pre-existing health conditions, most of them with cardiovascular diseases and diabetes. A couple of years ago, NASA also raised the flag for the tropical environment, suggesting that there is a potential super greenhouse effect due to increasing temperature in tropical environment that most likely will be increasing also water vapor in the atmosphere. And some other studies are suggesting that heat plus humidity are becoming too severe for human tolerance in many places of the world. And the Caribbean region is not an exception. More recently, in Puerto Rico, we have been suffering a couple of heat episodes during September and August, representing a potential threat to vulnerable communities with heat index increasing up to 111 and sometimes 113 degrees Fahrenheit. With landscape transformation and urbanization, we are promoting urban heat islands in San Juan, which is the capital city of Puerto Rico, increasing temperatures in high-density urban areas. So this is another important component, because then during 2017 hurricane season, the Caribbean suffered one of the most catastrophic seasons in recent history. And Puerto Rico experienced major disruption in essential services, water, and multiple other environmental stressors. And there was a lot of impact on ecosystems. For example, almost 4 million trees were destroyed and died after Hurricane Maria. And this is reducing the ecosystem services. And the vegetation is associated with cooling effects and temperature reduction worldwide. So after Hurricane Maria, we started working with National Cancer Institute. We had a proposal and working with the stressors that women with cancer, gynecological cancer, suffer in the aftermath of Hurricane Maria in Puerto Rico. And one of the most important things, what we heard about the patients, is that heat was one of the most important concerns for them, together with water, housing, and treatment. And this word cloud, what you're seeing is that as big as the word, meaning that's the most important thing for the cancer patients that we were working with. Going back. In our case, another component that I mentioned for the hurricane is that in Puerto Rico, there was a lot of, we lack of essential service because of the hurricane. And energy, in our case, is used in warm environments like Puerto Rico to cool indoors environments. So in the absence of energy and without vegetation to reduce temperature, apparently some Puerto Ricans were suffering from heat episodes in the aftermath of Hurricane Maria. So what we did is that we get in collaboration with other colleagues in the Caribbean, for example, with Thierry in the Caribbean Institute of Meteorology and Hydrology, and we analyze the climate information for temperature in Puerto Rico. And I mean to confirm this data. We understand and we saw that after Hurricane Maria, there was a heat wave that it lasts for, or at least temperatures that were above normal for 1 week after Hurricane Maria. We don't have the data. Obviously, thousands of people died in the aftermath of Hurricane Maria in Puerto Rico. We still don't have the data to say that people died because of the heat in the aftermath of the hurricane, but a fair assumption could be that the combination of factors, including temperatures, might be playing an important role in the aftermath of this hurricane, the lack of energy and the lack of vegetation that have the capacity to reduce extreme temperatures in a tropical environment. So thank you so much, and please excuse me for the interruption, since something happened. Thank you.
Many thank you, Pablo. I would now like to pass over to Ernesto. Ernesto, we are seeing your screen, but we are not hearing you.
Okay, cool. Do you hear me now?
Yes, we can.
Okay, perfect. Okay, good afternoon, everyone, and thank you for the invitation. I will be talking about the adaptation to heat and an early warning system and a little bit about the education in Puerto Rico. First, I need to start with the mission of the Weather Service. It's basically provide weather, water, climate data through forecast and warning for the protection, the life and property. And if we do an accurate forecast, we will try to enhance the national economy. And the vision of the agency is having a society that will be ready for prepare and respond to weather, water, and climate dependent events. Based on that, we are looking at different assessment or reports from the IPCC or the National Climate Assessment that shows that we will be having more hot weather days and probably more records during the next few years. And the graphic to the right shows that we will be an increasing of days with 90 degrees or more during the next few years if we use the trend line and try to linearly interpolate the following years. So Pablo shows a little bit about this, but I touched this again, mainly to show that heat is the main threat in terms of weather hazards in United States. And in the prior years, we don't have a lot of idea of what is the impact of heat in the Caribbean. So we went ahead and joined effort with the University of Puerto Rico and other colleagues to start doing some science background and understand the impact of heat in Puerto Rico specifically. Dr. Pablo Mendez already talked about some of this, and having those paper or those research help us to increase our confidence that heat is a main threat in Puerto Rico and the U.S. Virgin Islands. Our agency uses heat indices as a measure of how hot is the how much or is the apparent temperature when the temperature and the relative humidity is combined. So using that, if we try to think about a typical day in the Caribbean, it's about the mid 80s to low 90s. The relative humidity is pretty high every day, so fluctuating with the 60 and 70%. Having those values, we probably estimate heat indices between 90 to 105 degrees. So numerous days of dangerous heat conditions may occur in the Caribbean, and we think that we are accustomed to that. So going back to the research, we extract or came up with different thresholds to try to alert the public, not only to issue heat advisories or specific warnings, but also to have to mention the heat in a daily product such as the hazard weather outlook. This is an example of our hazardous weather outlook that we issue every day around 5 a.m. And we not only talk about heat, but also we talk about frequent hazards that occur here in the Caribbean, in the Northeast Caribbean. There are flood, thunderstorm, heat, wind, waves, and rip currents. So we include the heat threat a few years ago to try to engage the people and also to show the danger of heat in the islands. This is an example of the social media posts that we use Twitter and Facebook to try to tell the people, not only through our official products, such as the Hazard Weather Outlook, but using the social media to try to reach more people and younger generations and telling them about the heat threat for specific days. When the conditions are warmer or hotter, we need to issue a heat advisory, and we using our front page a color code map and with a legend where the people can click the hyperlink where you say the heat advisory, and they can get the text of the product. And basically the product, it's composed by a headline and what, where, and when. So we try to have a bullet form text product where we can talk about the heat indices, the time of the day, the specific locations, and the impacts, followed by a precautionary and preparedness actions we recommend the people to follow. And after the research, we start doing outreach with media partners and also other community groups to understand the heat threat. And thanks to that, the newspapers and media outlets are covering when we issue the heat advisories or heat or excessive heat warnings. So they help us. We consider the media part of the team because they help us to spread the word about not only the heat but other weather hazards that may affect the islands. This is an example. We don't only talk about the product in effect, the heat advisory or excessive heat warning in effect, but also we try to include some infographics that help the people to understand the temperatures, heat indices, and also the effects of the heat in the body. And also we get coverage of famous broadcasters across the island that obviously they have much more followers than us, and having that support, we were able to get more reach to the people during those cases. We try to target the most vulnerable populations, specifically pregnant, newborns, children, elderly, and the people with chronic illnesses. And we also infographic like this to try to catch their attention. In addition to that, the Weather Service, including our office here in San Juan, we have weather safety campaigns. And for example, during the summer, our outreach activities are mainly focused on flood, hurricanes, heat, rip currents, and lightning. But there are other campaigns through the years that we can talk about: fires, safe boating, and other hazards that may occur in the island, like drought and air quality. And finally, future work for us is investigate how and if the wet bulb globe temperature is more representative of heat stressors than the heat indices in the tropical regions. Thanks.
Many thanks, Ernesto. Great presentation. I'd now like to pass on to Lindone.
Okay, thank you very much. So in this presentation, I will demonstrate an evidence-based approach to establishing heat thresholds premised on the evidence of the relationship between meteorological conditions and health impacts. And specifically in this pilot project that was done in Grenada, we looked at impacts relating to emergency room visits, hospital admissions, and mortality. Now, it is worth noting that other approaches used in this region, and as we would have seen in the two prior presentations, strongly considers meteorological parameters, independent somewhat of assessment or a direct assessment of the relationship between heat and health impacts. So I'm going to present now this new proposed approach to heat health planning in the Caribbean region. In 2019, the Caribbean Institute of Meteorology and Hydrology verified heat wave occurrence in the Caribbean and the possible impact on vulnerable populations as well as livestock and poultry. A few studies we noted were done in countries that focused on the food animal production. PAHO, the Pan American Health Organization, however, supported this pilot study as the first of its kind to evaluate the relationship between extreme temperatures and other climatic conditions and human health impacts to inform the planning of heat health response in the region. The intention is to extrapolate the methodology used in this pilot study to the wider Caribbean region. So I just wish to acknowledge the many individuals and institutions that supported this project. And as I said, it was funded and facilitated by the Pan American Health Organization. So now the first step in this process, we did extensive review of the literature and found that countries used different health impact proxy in establishing heat thresholds. Recent evaluations suggest, however, that the use of one health proxy, such as excess mortality or excess morbidity, and so the use of one of those can contribute to either underestimating or overestimating risk of other significant outcomes. So in the case where excess mortality might be used, this can lead to underestimating or overestimating, for example, the risk for excess or the risk of excess morbidity. So it was recommended that both mortality and morbidity be considered in developing heat impact-based thresholds. So the dual proxy approach was used in Grenada, and we considered, as I said before, three factors: hospital admissions, emergency room visits, and all-cause mortality. The second step in the process was to select the meteorological parameters. And here we noted the limitations as well as the possibilities in Grenada. And there are several indices that can be used in these kinds of studies. However, countries would want to use variables that the population can identify with and interpret in the local context, such as temperature, maybe in Caribbean countries. In the United States, it might be heat index. In Canada, it might be humidex, etc. But you certainly want to use something that the country can identify with. Now, the World Health Organization and the World Meteorological Organization have provided in this document that is shown there, titled Heat Waves and Health, Guidance on Warning System Development. They have provided algorithms for calculating compound variables, for example, temperature and relative humidity together, or using other biometeorological values together with meteorological values to derive compound variables. In Grenada, we used 7 variables. So it gave us a chance to understand how the interplay between meteorological conditions can impact health, and how we can utilize this information to derive the threshold. The third step in the process is a bit interesting in that we use the R package distributed lag nonlinear model to determine the delayed and cumulative relative risk associated with increase in the value of the meteorological variables. Now, this approach is rarely used, and it is just beginning to evolve as a better practice in assessing health impact arising from exposure to meteorological events. Now, the delayed effect really is what we call forward interpretation, and it indicates the increase in relative risk. So using this model, we derive relative risk after each day of the event being present. And we can also derive what we call a cumulative effect or backward interpretation as well. So quickly looking at the forward interpretation charts to the left, we see the relative risk of hospital admission peaked between 3 to 5 days after temperature reached 26 degrees Celsius in Grenada. However, note that at higher temperatures, 29 degrees Celsius, 30 degrees Celsius, and 33 degrees Celsius, our max was about 32.8 thereabout. At those temperatures, you would notice that the peak came much earlier, which means hospitalization or number of admissions occurred much earlier. And you would also note that as the temperature increases, so too the relative risk increases. And this is a very important evidence to support decision-making regarding the point at which a threshold should be established. It also gives good indication about population response. So there are different approaches that can be used to select the threshold, and those are listed here. In some cases, you can use temperature only, or a combination, or a compound variable, or even hybrid approach. Day and night considerations are also worth noting, as more and more we are recognizing that nighttime temperatures, high nighttime temperatures can also have very serious impact on health as well. The policy implications for the region, we need to note here that the pilot study has implications for new policy directions, ensuring that there is better alignment with the climatic conditions in the region and health impact, and using that evidence to support the planning of heat health response actions. Thank you very much, and I look forward to your questions.
Thank you very much, Lindone, and thank you very much to all three panelists. Very complete and interesting presentations. So I would like to put a few questions to you now. There are some questions that have been asked. If you can all turn your cameras up, that's great. So the first question, and I think this mostly goes to Pablo and Ernesto, who presented the same slide, was how many days each year is the heat threat moderate, i.e. between 108 and 111 degrees Fahrenheit, or high, above 112 degrees Fahrenheit?
Ernesto, would you like to answer that question?
Sure. In the operational perspective, we are looking at the data closely as Paula does. I can estimate about probably 10 to 15% of the time it's moderate, and only 5% it's the excessive heat warning. Those numbers could change in very hot years like 2012 and this year, even this year. But normal years are about that percent.
I would like to
You
add
can
something very
add
quickly.
anything if you want, Pablo.
Yeah, I will add something very quickly. In the case of 2012, for example, we had like in the summer, during the summer of 2012, it occurs for almost beyond 50% of the time during summertime. So it was a long lasting heat episode for 2012.
I think it's fair to say as well that this is very not only country specific, but location specific. As mentioned in the presentation, the heat island effect has differing consequences on health, and these ranges can't be taken as absolutes. So the next question is with regard to heat relief centers or measures. And the question is, what heat relief centers or measures has Puerto Rico set up in anticipation of heat waves?
There's no such thing
Pablo?
as cooling center. There's no such thing as cooling center in Puerto Rico, unfortunately. This is something that some government agencies, as the National Weather Service and the Departments of Health, started to recognize as a potential public health issue, but yet still is not recognized at the government level to delineate strategies to address these issues of heat in Puerto Rico. Therefore, there are not any other kind of recommendations of what to do outside of the National Weather Service, and there is no cooling center identified or anything, at least not yet.
So here I would like to say that there was a recent publication from earlier this year on evaluating the effectiveness of different measures. So not only cooling centers, but the other measures that can be taken at a global level, done by WHO. And I invite you all to look at some of the evidence that they have of the different measures that can be taken. The next question is from Dr. Enriquez. I am assuming that it is also referring to Puerto Rico. And the question says, hello, the subject is very interesting and he would like to know how to communicate with you because he has an idea regarding heat alerts for people at risk. And he is a dental surgeon. So I think that in the biographies and in the information from the panel, there are the contact information of the 3 panelists, I believe. So, but I don't know whether either Pablo or Ernesto want to add anything.
Yeah, I will write my email in the chat, so and you can contact us through the email, and then afterward we can talk.
I will do exactly the same thing.
Perfect, thank you. The next question, more generally, and I would like to put to you all, and also especially to Lindona, who has been looking at some of the data. So it's looking at the long-term impacts on heat stress, and do they differ for men and women? Do we see differential impacts, health impacts for men and women from heat?
Okay, so in the Grenada context, the study that we did not zoom in on the difference in the results between men and women, but certainly any exposure, generally in risk assessment, exposures can certainly lead to differences in outcomes for different subpopulation groups. So this is an area that maybe countries in pursuing this kind of studies may want to better understand and seek to implement research or studies to understand whether there are any differences in terms of how heat impacts men and women. But for now, for the study that we did in Grenada, the pilot, we did not focus on that particular area, but it's a great question and it's an area that we definitely would want to pursue in the future.
I don't know whether, Pablo, you have anything to add to this?
Yeah, thank you. When we did the analysis on mortality in Puerto Rico, we did find like a profile, but related more with pre-existing health conditions. We didn't find anything associated with gender, at least not back then. We're looking forward to repeat that research project now with more updated information in Puerto Rico, and we will look into the details about the gender situation. About, let's see what we can find.
Ernesto, do you have anything to add? Thanks. So
No.
I would also just like to add the point that we have to be careful when analyzing data, and especially data between gender and something like heat, because of the different occupations that are present and the different exposure to heat that different occupations have. So we need to be very cognizant of really separating the issues out. But before I go to the next question that's in the chat, this brings me to a question that I had, and maybe you'd be able to comment on, and that's looking at the research gaps that are needed. Both Puerto Rico and Grenada, relatively speaking, are quite small populations. So would you be able to tease out some of these things in such small populations, and how do you see the biggest research needs going forward, with exception of what was mentioned already by Ernesto, which is looking at the wet bulb and heat index measures to really assessing that bit? But what I will go one by one. What do you really see as the biggest research need, and what were some of the research challenges going forward? So maybe if I can start with Ernesto.
Sure, thanks. In our case, it's difficult to see the impacts right away. So in the operational area that we need to have the impacts or have some idea of what are the impacts with the threat to see how that weather hazard impact the society. And it's kind of difficult because we need to get the admissions. It's not real time. So changes in the procedures are difficult because we don't have that data on hand. If we have a better communication with hospitals or real-time data, it will be easier. If we compare that with wind damage or flooding, we get basically instant information in the two ways about the hazard and also the warning that we are issuing prior to the event or after we see the event. So I would say, I don't know if it will be possible to get the data real time. I know there are some difficulties, but it would be great if we can have that.
Thank you. Pablo?
Yeah, thank you. I will say that at least in Puerto Rico, we don't have access to data. That's one of the issues. We would love to make one study, as the Lyndon show, really beautiful with robust data about hospital admissions and emergency room visits. That's very useful to establish, at least to measure the impact or measuring the magnitude of the impact, right? That's one of the things. When we're measuring only mortality, mortality is only the tip of the iceberg. So that means that it's really people that is really very deteriorating in their health conditions, right? So I think that one of the things is that we need to incorporate that part, accessibility to the data, meaning that the Department of Health need to incorporate climate change impacts that is a reality also into the policies and the rules and providing the information. And another thing that we need to try to work on are on adaptation strategies. How do we start to acknowledge that green infrastructure and vegetation can be a very powerful tool to protect us against extreme heat? And that's a long-hanging fruit, right? We're not talking about only oxygen exchange with the atmosphere, but also reducing temperatures. That's another thing that we need to measure, not only measure and to validate, but also to promote those kind of strategies in Puerto Rico. So yeah, those two kind of things. Thank you.
Thank you, Pablo. Lindone?
I think one of the points already brought out was the need to improve the data that is available in the region. We need to understand clearly and distinguish health impacts resulting from the exposure to heat, and that needs to be captured by the system. So that would be something that needs to be properly defined and captured by the system. But also we need to look at the additional or other environmental conditions that can also impact on those kind of outcomes, or there can be an interplay between those and extreme conditions, such as air pollution. So those are other areas, additional areas that we might also want to look at and see how they impact or contribute to the results we are seeing from exposure to heat and high temperatures.
Great, thank you. There are quite a lot of questions and comments in the chat, and I invite also the three of you to have a look and answer some of them. The next one is looking at the threshold and says, would a threshold be region specific as the human body adapts or acclimatizes to a region? And the answer is it's not only, well, I suppose it depends what you mean by region, but it's very specific to a small area, yes, but people also migrate and move, but you can acclimatize over time. And could you indicate what material the WMO provided? There are quite a few WMO, WHO guidance documents on heat and health. Several of them were in the presentations both that were presented, and they are all available on the web, both the WHO and WMO. What value do you attribute to the increase in the minimum temperature in the incidence of a health crisis? So, Pablo, maybe you want to take that one first?
Oh, okay, you mentioned a lot of other questions. I didn't know where to start.
Start with the last.
Okay, let's start with the last one. Yes, indeed. What we found in Puerto Rico in terms of mortality is that it's not more associated with daytime temperature, but also with the nighttime temperatures. And that is when people are more concerned as well. So not only with mortality, but also when we were working with the cancer patients are most likely, if they are receiving chemotherapy or treatment, they're most likely to suffer from hot flashes as well. So, and these cancer patients, both in Puerto Rico and US Virgin Islands, were complaining about heat during and after Hurricane Maria, and most likely because of the treatment and because of the lack of energy. So, and during the night. So meaning that they were sleeping in uncomfortable temperatures for a long period of time after the hurricane. So yes, for example, at least speaking with the people and analyzing the data, I will say that nighttime temperatures are the biggest concern than daytime temperatures.
Lindone?
But with regard to the point that Pablo just made, I think this is, as I mentioned, a growing concern. And we see from the examples of what has been happening in the US, when we develop heat thresholds, in the region, I think we need to give serious consideration to that as well, because people are indoors at night as compared to being outdoors. They may be in air-conditioned buildings, for example, in the day, but when they go home, they do not necessarily have those facilities. So certainly, those are the things that we'd want to look at as we continue to implement these methodologies in the Caribbean region.
Go ahead,
One
Pablo.
last comment. Thank you, Lindona, because you bring something very important to the discussion. Heat is not only occurring out there alone by itself, but it's interacting also with a lot of social determinants of health, meaning that obviously we are in the newer society, we are living more in indoors environments than in outdoors environments. So if in our house, we don't have the capacity to have the adaptation facilities as air conditioners or good ventilation to mitigate heat episodes, that's potentially are increasing the vulnerability in your house during a heat episodes. So social determinants of health, income, pre-existing health conditions, education, all those kind of determinants are interacting directly with the extreme weather event, such as heat. So yes, that's something very important to consider.
So we need to wrap up in a few minutes, but I would like to pose a question and give you all 1 minute to answer, and if you can, or at least shed some thoughts. And that is, what ideas do you have to break down the silos? So the data that is needed to do the research that is needed to do these type of interventions can be accessible by the Ministry of Health or the Weather Service. So let's go in the order of the presentation. So Pablo, if I can start with you.
Okay. Well, I think that conferences like this one are very important because it providing us the space to chat and to have a conversation with different stakeholders, decision makers, and to share our science with potential decision makers. So that's one of the things. Having a long-lasting collaboration is something very important also. I've been collaborating with Ernesto Rodriguez and the National Weather Service for almost a decade. And as a result of that, so I think that we have been able to influence decision-making in Puerto Rico very slowly, but we're doing something. And also the media with Ernesto, something that is very important for risk communication. So those are my only comments. Thank you.
Thank you. Ernesto?
Yeah, for sure. As Paulo mentioned, decision makers needs to buy that the heat it have an impact in the society, and as soon as we have that support, we'll be able to see the data flowing. It's all about they don't understand the risk. They think that we live in the tropics, we are accustomed to heat, and heat is not part of that. Also, the practitioners needs to understand the impacts of heat. So every time that somebody die, they will be able to understand that they die due to heat, not for other causes. So that's it. Thanks.
Thank you, Ernesto. And Lindone, last but not least.
So we have been speaking about in terms of building our systems to address climate change, bringing together meteorological information and epidemiological information, merging and compiling those together and making them accessible so that we can clearly understand the impacts of climate change on health. That is really necessary, and this is something that we have been advocating for in the region, although countries do not necessarily have the resources to do so. But clearly from the pilot study in Grenada, I think the next steps, and that probably should be the drive for other Caribbean countries, is to start creating a platform to bring all of those information together in a central place where we can easily now first do a pilot study and then reassess the efficacy of those thresholds to ensure that we can protect our Caribbean peoples.
Wonderful. Well, with that, I would like to thank all three of you for your wonderful presentations and for the discussion, and apologize to those people whose questions and comments we didn't get to. But we need to wrap up now, and thank you very much. Bye-bye.
Thank you.